If you are one of the tens of millions of people who've had to deal with chronic low back pain, you know exactly how frustrating it can be. I mean, it's a leading cause of disability all over the world, and for way too long, our main approach has just been to, well, manage the symptoms. But what if we could do more than that? What if we could actually restore function? It's a question that's leading to a completely new, kind of revolutionary understanding of what causes this pain in the first place.
And just to get a sense of the scale of this problem, look at the cost. In the United States alone, low back pain carries an estimated annual price tag of $200 billion. That is just a staggering amount of money, right? It's spent on treatments, lost work, disability. It's a massive burden, not just on people, but on society as a whole.
So, this leads us to the big question we're really digging into here. With all that money being spent, why do so many common treatments, things like injections, pain meds, why do they so often provide only temporary relief, if they provide any at all? It feels like we've been missing a huge piece of the puzzle, and it turns out we might have been looking at all the wrong places.
The answer, it seems, might not lie in the bones or the discs themselves, but in a hidden culprit, a really crucial muscle that our own body has basically forced into hiding. To get this, we've got to look deep inside the spine support system. So, let me introduce you to the multifidus. It's not actually one single muscle, but a whole group of small, deep muscles that run right along your spine. Think of them as the fine-tuning stabilizers. They give you that segment-by-segment stability, keeping your lower back strong and controlled when you move. They are absolutely critical for a healthy back. Okay, so here's where things get really interesting. There's this phenomenon called arthrogenic inhibition. Basically, when your spine gets injured or you experience pain, your central nervous system sends out a signal to shut down the multifidus muscle. It's trying to protect the area. It's a protective reflex, but it's one that can kick off a whole cascade of new problems. And this just perfectly illustrates the vicious cycle that traps so many people in chronic pain. It all starts with the initial pain, which causes the muscle to shut down. Then, because it's not being used, the multifidus gets weaker and wastes away. This makes the spine unstable, which then causes more stress, more strain, and, you guessed it, more pain, which just starts the whole cycle right back at the beginning.
So, if this is a problem of muscle function, how can doctors even diagnose it? It's not always something you can just see on a standard X-ray or an MRI. They need a way to find this specific functional fault line.
And this gets to a really, really crucial point. While an MRI might be able to show you that a muscle has gotten weaker, it can't tell you if it's actually working the right way. That's why a hands-on physical exam is so important for diagnosing this kind of instability. It's all about function, not just what the anatomy looks like. Doctors use this remarkably simple and logical test called the prone instability test, or PIT. It's pretty cool. First, the doctor presses on a part of the spine, which, in an unstable back, causes pain. Then, the patient lifts their legs up. This forces those back muscles to fire up and stabilize the spine. While those muscles are engaged, the doctor presses again, and if the pain is gone, the test is positive. It's direct proof that activating the muscles provides stability and gets rid of the pain. So, once you've identified the problem as a loss of muscle control, the solution suddenly becomes crystal clear. It's not about masking the pain anymore, it's about restoring that control. And this represents a huge fundamental shift in how we approach this condition. This really highlights two totally different philosophies. On one side, you have palliative treatments, like injections or nerve ablations. They focus on blocking pain signals. And sure, they can give you some temporary relief, but they do absolutely nothing to fix the instability underneath. A restorative approach, on the other hand, directly targets that root cause, retraining the muscle control to restore stability and hopefully break that vicious cycle for good.
This brings us to the new therapy, restorative neurostimulation. Now, it's an implantable device, but, and this is key, it's not for pain relief. Instead, it sends tiny electrical pulses directly to the nerve that controls the multifidus. This makes the muscle contract, basically overriding the brain's shut-down signal. Twice a day, the patient just activates the device, giving that muscle a workout to retrain the brain-muscle connection and rebuild its strength and control over time.
Okay, this all sounds really promising in theory, right? But as always, we have to ask the big question. Does it actually work? So let's take a look at the clinical evidence. The key study here is a big, randomized controlled trial called Reactivate-B. It had 204 patients who all had this very specific diagnosis, chronic, mechanical, low back pain caused by multifidus dysfunction. This is really the gold standard for clinical research.
And the results after 2 years were, well, they were pretty remarkable. Get this, 71% of patients saw a substantial reduction in their pain scores. We're talking 50% or more. 61% had a major reduction in disability, which means they could just function better in their daily lives. And crucially, for those who were taking opioids when they started, 60% had either cut back their dose or stopped taking them completely. And you know, maybe the most meaningful number of all is this one, 65%. After 2 years, nearly 2/3 of patients reported that their chronic low back pain was effectively resolved, with their pain scores dropping down to a minimal level. This isn't just managing pain, this is resolution.
And here is what makes this so different from everything else. With most pain treatments, the effects tend to wear off over time, right? But here, the exact opposite happened. The benefits actually got better between the 1-year and 2-year checkups. This is exactly what you would hope to see from a true restorative therapy, as those muscles get stronger and control gets reestablished.
So what does all of this mean for the future of treating chronic back pain? Well, it suggests we're at the very beginning of a major shift in how we even think about the problem.
The big takeaway here is this shift in focus. We're moving away from just managing symptoms and moving toward truly restoring function. We're going from a cycle of temporary procedures to what could be a lasting solution that addresses the real cause. It's all about targeting the neuromuscular problem, not just chasing the pain signal.
You know, the researchers themselves really said it best in their conclusion. They wrote that this therapy changes the treatment paradigm and that it has the potential to end that endless cycle of ongoing procedures that so many patients have to go through. That is a truly powerful statement.
This whole thing really points to a profound final thought. For decades, the goal for so many chronic conditions has just been management. But this approach suggests a totally different future. What if the goal isn't just to manage pain for the rest of your life, but to actively restore the body's own systems, empowering it to stabilize and heal itself? It's a fundamental change in perspective, and honestly, one that offers some real hope for millions.